All right, so for session 2, we're going to be talking about a public health approach to human trafficking. So to start, what is a public health approach? So there are two different frameworks that we talk a lot about, which is the criminal justice framework and the public health and prevention framework. So in the criminal justice world, the focus is primarily on upholding the legal framework for victims. Has a very defined timeline. It is justice oriented, or at least what they define as being justice. It is government based, and the purpose of that is to punish traffickers and recover victims. When we look at that compared to a public health or prevention framework, we're seeing advanced individual and population health focus. So the center is on the patient or the clients. It is a long-term process. There's no defined timeline. It goes in the timeline of the individual. It is individual, family, and community oriented. So again, it is not necessarily focused on that justice piece. It is focused on the wants and needs of the person it is targeting. It is community based. So it is done through a variety of services, not just one. And the focus of it is to prevent and treat harms. So rather than a responsive framework, it is a prevention framework. We'll get into that a little bit more too, and what those tiers are for prevention later on. So the goal of the criminal justice framework is to prosecute traffickers, to find people who are breaking the law, causing harm in the community. And the primary goal of public health is healing and finding that the way that the victim needs and wants the most that is going to work best for them. So I had mentioned the language earlier of a transformative justice framework versus a criminal justice framework. Which again focuses on how can we transform this person? How can we present them with the options that give them the most possibility to heal? We also look at language, so victims versus patients, right? We see the goal is to recover victims rather than prevent or treat, or meet the needs of the patient, the person seeking services. So again, disclosure, not the goal in a public health framework. Under public health, the to human trafficking response, disclosure is not required to provide comprehensive quality healthcare or referrals to other services. However, if that disclosure does happen, you need to know your limits to confidentiality. And where this is significantly different from the criminal justice approach is disclosure is necessary for the criminal justice piece to work, right? They can't prosecute a trafficker if nobody tells them what happened, right? We can prevent and treat harm for somebody that doesn't disclose the details of their victimization through a public health approach. And knowing your limits to confidentiality, we will talk a lot more about that as we continue on in today's training. So trauma, current, past, secondary, vicarious. There's different forms of trauma that people experience. So current trauma is something that somebody is actively going through. It is, they're actively in a state of fight, flight, freeze, fawn, right? They're in a place that is unsafe, that they are going to, once that ends, it will become a past trauma, but right now they're living in that space. Past trauma, things that have happened to people over time, right? So when we look at trauma, somebody who is experiencing current trauma can present as appearing intoxicated, under the influence of drugs or alcohol. It is important to get a full medical history that includes trauma to get those accurate diagnoses. Sometimes those frequent flyers, those high need patients are experiencing a trauma response. Be mindful of this when taking patient notes. We'll talk more about those patient notes later on. Instead of writing something like the patient was unruly and appeared to be drug seeking, say Patient was experiencing extreme discomfort, making it difficult to pinpoint exactly where the pain was coming from. Patient requested medication. However, through a more thorough exam is needed before prescribing any medication. Being mindful of the language used and the way you're talking about that patient can be a game changer in their care. And keeping in mind, those records last forever, right? The next person providing care to that person is going to see what you wrote, and they're going to use that to determine their level of care provided. And when we look at what you put in their chart, it, like I said, it can and will dictate the treatment they receive in the future. And then looking at secondary and vicarious trauma. So be aware of your own trauma, things you have experienced in your own life or other things that you have witnessed, right? That vicarious trauma piece. Everybody has their own story. Everybody comes to the table with their own experiences that shape the way that they see the world. Sometimes our patients can trigger us, and that's okay. We need to be able to recognize that so we can provide the best care possible. Know when it's appropriate to step away, assign a different position, or ask a different nurse to sub in for you if you're able to. If you are the only provider there, talk to somebody else around and try to figure out how you can best support that person when you are the only one able to do that. And, if you get activated, it can compromise the care of that patient. So keeping that in mind, and it's not something to be ashamed of. We all experience that at many points in our life. And sometimes it comes out of nowhere. We're not always going to be prepared for that. So take a step away. It sometimes takes strength. Or it takes strength to know when you need to step away and take a moment for yourself. Is not going to compromise the care of that person if you take 5 seconds to take a deep breath. Unless it's critical, right? Then know the time that you need to step away and when that's appropriate. But in most cases, you'll have the space to take a deep breath, to do a grounding exercise, do something that allows you to take back control of your own body, your own self, before you are caring for somebody else's. Any questions on the conversation of trauma? Okay, if you are typing, I'll get to it as soon as I see a comment pop up. So now I want to talk a little bit about bias, right? So what is bias? It is conscious, it is unconscious, and it can play a huge role in the quality of care the patient gets. So conscious bias being attitudes and beliefs that you are aware of that shape your perception about something, right? Unconscious bias refers to the belief and attitudes you have, which are outside of your awareness or control. You may not know you hold a certain belief or where you learned it. Unconscious bias can become conscious bias the more you look at your behaviors and attitudes. So like I was saying, with the way you're talking about patients or the way you're referring somebody when they're around or not around, right? I'm sure all of us are guilty of getting frustrated with somebody and talking to a peer or a colleague about just how frustrated you are with the way they did something or the things they said, right? I'm guilty of it. I'm sure you are too. But recognizing like, okay, why am I feeling this way? Is it just because I'm frustrated, which is a very valid reason? Or is there something else at play here? Am I frustrated because I have read the notes and it says that this person comes here all the time. They're always med seeking. They have a history of abusing the system. And I just don't want to deal with it because I am reading what other people have experienced with this person and not coming in with my own unbiased experience, right? We can look at those notes and use that to guide the way that we treat the patient medically, but not the way that we treat them personally, right? They don't need to know that you have read all the negative things that have been said about them, or the opposite, right? Somebody comes in and they have absolutely no medical history, and this is the first time they're being seen, and you are asking them questions, and are you jumping to different judgments because of things that they're saying, because of the way they look, because of the things that they're not saying, right? A lot of the times when I am dealing with somebody and I just don't know why I'm feeling the way I am, I'll take a minute and say, okay, where are my biases in this? Why am I responding the way I'm responding? And what where is it coming from? Am I being biased about this certain thing? And it's okay to say, yes, I am, because you're recognizing it. But then what are you doing to change that bias? If you say, yeah, I'm being biased and do nothing about it, that's problematic, right? That's going to compromise the care that person is getting. If you're saying, yes, I'm being biased, okay, I'm recognizing this. Now we need to address this. How can I address my bias so this person gets the best quality of care possible? Um, because that's really important to make sure that our own feelings and perspectives and emotions aren't being projected onto the person we're caring for, because that can compromise their ability to feel comfortable sharing things with you, right? We've talked about how disclosure is not the goal, but if somebody is in an unsafe position or situation and you establish the rapport so they can see you as a trusted adult, then they might feel comfortable disclosing and asking for help. And that's what this next video is going to talk about. It's called Adults Can Help. It's from this same group of videos from the last one that we just watched. So I'm going to mute myself. Somebody in the comments, again, can you just let me know the sound is working, because again, not that tech savvy here.
Oh, Jeffrey was such a sweet and lovely young boy. His life was truly, interrupted by substance abuse, and also those who prey on addicted kids. When instances like this happen, I feel that it is on all of us in society to ask questions about what was it that we could have done better, and how could we have helped this family, and to expect that families can solve this problem alone is not recognizing the nature of this kind of abuse of our children.
I remember one interview we did with her asking if she could please tell us what was going on. She had bruises on her face, but she still would not tell us exactly what was happening because she was still way too much under the influence of her trafficker.
He was frustrated with me because, I wasn't very vocal. I held a lot of stuff back.
So finally, when she had enough counseling, enough help, she came to the realization that she'd lost portions of her life and she wanted to turn her life around. So that's when she started talking to us, and that's when she started working with us as a victim witness. In the same process, we were able to have other victims come forward, which made a significant case against her trafficker, and eventually it ended up going to a federal jury trial for which he was found guilty on all 9 counts.
Didn't want to be alive, I didn't care anymore, and feeling that way isn't really going to make me want to help myself. So having somebody to change that perspective, even just a little bit at a time, is really important. It was nice. It was really nice because I wasn't in a really good place, and it was nice to get some empathy for a lot of different things that I was going through.
We talked about things that all adults need to be prepared to talk about with young people. About what are healthy relationships, what is abuse. There are young people out there like Aiden who are ready to talk to us about difficult things and want us to help them make sense of them in order to achieve safety. And if we fail to do that, then we're failing at doing our job.
It's always difficult to be a young person. Being a young person in our society with technology and selfies and Facebook and Instagram, social media, the pressures are unbelievable and they're unrelenting. But everybody cares. People care. So I think it's on all of us as a community to really strongly intervene in the lives of young people.
These young people are summing up whatever strength they have to be strong, and to be strong in the face of some really, really terrific odds against them. And so to hear the word victim would feel very vulnerable to someone who's doing whatever it takes to be the strongest person they can possibly be. If we're waiting for kids to, come to us and say that I am a victim, then, that is, going to be too late. We need to be aware that this problem is occurring. We need to be aware that the purchasers, the demanders of sex, could be anyone and can look like people you know, and that the kids are waiting for somebody to do something about it.
Start looking out your back door, start opening up your eyes, start seeing young kids who are hanging out with older adults, start calling that in, start watching it. There's reasons. Like, people don't realize, like, you see 13, 12-year-old, 14-year-old kids with 21-year-old, 22-year-olds, 23-year-olds. Why? There's something going on. Either they're teaching them prostitution or to get into drugs or to do something that they shouldn't be doing.
Start talking to your children about things that are happening. When you see sporadic life adjustment, or all of a sudden they have all these unexplained friends that you don't know anything about. Children are always trying to tell you something, but are we listening? And that's the thing. Those hard questions that you don't think that you want to ask, if you don't, somebody in the street are going to give them the answer to it, and it's not going to be what you would have told them.
So adults need to be prepared to listen to kids' stories, no matter how dark that narrative might be, and no matter how upsetting, so that a young person feels like you are not trying to correct their behavior, but you're trying to understand their behavior.
There tends to be some blame. Like, what did you do to deserve this? Like, I think a lot of us don't understand, like, how this happens so easily and how just complex the manipulation is. For a lot of young people, it's having someone articulate to them that your feelings are valid, you're feeling them because they're real, and that when adults start to recognize that those are real feelings, then maybe it provides a safe place for them to ask for help. And generally speaking, I think that that's where we find our relationships kind of begin with young people, is when they've experienced some validation for the way they feel.
This is one of the rooms that we have for the ladies that come in off the street. This is like an overnight spot. It's called Humble Beginnings. You have to start somewhere. Why not here is our motto. Say, when you see me, what do you see? Do you believe this was a face of a girl that was trafficked? Because you see my end result. You don't know my beginning. Start asking. Be inquisitive, but don't pry. When I was in the life, I thought about, why didn't anybody ever ask me what was wrong? So that's why I do what I do, because I want to make a difference. For everybody that didn't ask that question, I'll ask it. For everybody that oversees things and think it's a hard question to ask, I'll ask it. But I'll be transparent first so you'll understand. I know that you want somebody to ask you that question. And I'm not prying and I'm not digging, but I understand you. Because it once was me. I was that girl that was misunderstood. I was that girl that was looked over. I was that girl that was ostracized and bullied. I was that girl that didn't feel like she fit in anywhere, but the street accepted me. And I found my place there and my home there. Be a listening ear and really care. and most importantly, be honest. Because the more honest you are with yourself about what's happening to our youth, the more they feel like somebody cares enough to make a difference.
I think it's a mistake when you meet somebody who isn't sure if they've been victimized or not to start out asking them, what did you do? And in fact, the way you start is to ask them, what did the person who hurt you do?
Teachers do this a lot, like people in my work do this a lot, where we don't ask what happened to people, we ask, why did you do things? And that becomes a big barrier for why we can't, resolve some of these issues. We're not trying to fix, we're not trying to save young people. We're just trying to be a presence in their life, and we just want to be available to them. And through that, you can build relationships, and you can start to make suggestions about things. We can start to have conversations about some really kind of messy conversations. So like, what are you doing to keep yourself safe? A lot of kids aren't used to being asked that. Like, how do you keep yourself safe? So we have those conversations that a lot of adults aren't willing to have with young people. Sometimes it takes a long time for them to build that trust with us. A lot of adults think that that's just they're being rejected. Like, I just want to help you. Why won't you accept my help? And they might go right back to what it was, what we would say is dangerous or unhealthy behaviors. But know that the longer we stay in their corner, eventually they come back to us. But it takes time. It takes a ton of time.
If they've been arrested for anything, many times they don't trust the police right off the bat. And so that's why we offer to have them talk to a counselor. We really need to earn their trust. So if they call, like maybe after we refer them to services, and they call and they want to talk to us, it's really important that we pick up the phone and talk to them, because they need to have somebody they can count on.
And you never know who's going to have that ability to have that relationship. You never know who might be at the right place at the right time when that kid's feeling vulnerable and asks for help.
We help with job readiness, we help with transportation, all of that happens. If you want to know something from a young lady or a young man, then tell them about you first before you start prying into what their life's about. But if you stop long enough to say, you know what, I remember when I was 16, and that commonality helps children to understand that you do understand. You are listening, and you do care.
Okay, any questions, comments about that video? I think one of the most powerful quotes in there for anybody in the victim service field or anybody that encounters victims is, be inquisitive, but don't pry. I really like the language of that, because I think it speaks to a lot of what I'm talking about today. The disclosure is not the goal, right? We don't need them to share every detail of their experience to be a safe adult, somebody that they can build rapport with and somebody that they can trust. And I do understand that in the healthcare profession, there isn't always time, right? Time isn't always on your side. You don't always have the ability to really build that rapport with the folks you work with. But in the short amount of time you have, it is possible by asking those questions. I mean, and what she said too about, I remember when I was 16, the things I did at 16, and look at where I am today, right? It's possible. You will get there. Right now it's hard. Being a kid is hard, and it's painful, and it's a lot of learning. And I will acknowledge too, these videos really do talk mostly about youth and intervening with youth. But this is also important when working with adults too, right? Because adults that are experiencing these things are not getting that validation, that affirmation of their feelings outside of their harm doer, outside of their trafficker, right? Of their boyfriend, their significant other, their parent. They're not hearing those words from other safe adults. And that can be game changing as well. So we will take another quick break here. So I will see everybody back at 10:10. We are running a little bit ahead of schedule, which I am okay with. It means y'all get a bit longer of a lunch. So yeah, I will see everybody back here at about 10:10.